city party unless we have some technical difficulties. All right, so if everybody can hear me, y'all just bear with me. We all want to be really quiet and really respectful of our neighbors because I think some of our speakers are not working back there. So if somebody is speaking softly, y'all just kind of give me a hand raise so I can tell them to speak up a little bit for that one row of speakers that's not working. Is everybody good with that? All right. Well, good morning. I'm so glad. Nope. Hello? It went away? Hello? Nope. Hello. All right. So, Brian, you just bring that one back on up here and we'll figure this out. We'll figure this out.
Okay.
Can somebody figure this out? All right. Good morning. I'm so thankful that y'all are here. Welcome. My name is Jeannie Blake. Hello? Okay. Okay. My name is Jeannie Blake. I am the Director of the Benefit Advisors with the State Employees Insurance Board, and I am so glad to welcome you to our annual Payroll Personnel Conference. All right, I'm looking at my IT guys. All right, so y'all know the drill. We're going to go ahead and get started. Y'all, if my clicker doesn't work, I think I might cry. I promise when we got here at 7:30 this morning, it all worked. Okay. Thank you. Oh, good. All right, so we want to thank our sponsors this morning. The wonderful breakfast that you guys got was provided by Blue Cross Blue Shield of Alabama. So Miss Lynn in the back, she was so sweet and took care of us so well today. And then also Empower, those they are the retirement plan. They are in the back to the left as well, and they are the ones that provided our drinks today. So they're going to keep us good and hydrated. And then Humana, Miss Nisha's in the back, and she is going to provide us with an afternoon snack today, okay? So we're going to keep you full, fed, and fun, all right? All right. All right, so this is our agenda today. It is in your packet. I have printed out a little PowerPoint, the slideshow for you. And so you guys will see the agenda's in there. You can kind of keep track with it. We are going to do our best to keep on track. As you guys can see, you get a good long lunch break, so you're welcome. You just live your best life and go eat where you want to. And then hopefully we are going to get done around 4 o'clock today, okay? If I can get you out sooner, I promise I will. All right, and then what we're going to do is I am going to welcome SEIB has a new Chief Executive Officer. If you guys don't know, Miss Stephanie Azar is now taking care of us and our agency and you guys as well. So I am going to welcome her up here. If y'all will give her a big round of applause, and she's going to introduce herself.
If I've been in a dead spot over here.
Hello. See, yeah, okay, it's working for me.
I know.
Standing here, that's good. I have to move around. Well, good morning, everyone. I just wanted to come by today and just introduce myself. I've been in this role about 2.5 months now. I'm really enjoying the opportunity, but mainly I wanted to just welcome you guys. It's really good to see everyone here and learning as much as you can about your benefits that you're offered. I think that's just a wonderful thing. One of the things I wanted to do today, I'm going to be up here just briefly, but I wanted to kind of talk just a minute about how SEIB is funded, okay? Because everyone knows or should know that the healthcare cost in this country is rapidly increasing, okay? And SEIB has seen our medical and our drug costs rapidly increasing like around the entire nation. We are not alone. It is happening to every plan that is there. And in the last several years, SEIB's expenses has exceeded its revenue, okay? So that's important to know, and we've been working on reserves, and it's estimated that at the end of 2026, we begin fiscal year 2026 today, so we're estimating that those reserves are going to be depleted. So we had to work with the board, our 11-member board, to try to address a pathway forward over the next several years. So the way SEIB is generally funded is in 2 buckets. That's kind of the way I had to look at it myself, which is the one you're definitely familiar with would be the employee premium, okay? That comes out of your check as a state employee and pays a different premium depending on if you're single or if you're married or if you have a spouse and those sort of things. Then the second bucket is what we refer to as the state rate, okay? The state rate is what the legislature will decide on what that rate will be with support from the governor's office. So it's the state of Alabama with taxpayer funding pays for a state rate. So beginning 26, fiscal year 2026, which is now, today, we began that fiscal year, the legislature in the last session funded $1,025 per member per month for every active state employee. That's what they contribute, I can't talk, per month for each active employee. What you see in front of you here would be the fiscal year 27 SEIB funding request. The reason we're calling it a request is because we will have to go to the legislature and show them why we need an increase in our state rate. Okay, and SEIB, myself, and the staff will be very present, making sure that the governor's office and the legislature understands why this is needed due to the healthcare rising cost across the nation. So we're going to do a lot of work. And as a member, if you have an opportunity to ask for support for that, then you need to do so. So this would be the fiscal year 27 rate request if we're granted it, which would begin this time next year. You will see that it's $1,175. This is what the board allowed SEIB to go forward and request this rate. That is a substantial increase from the $1,025 for this year that I just mentioned to you, for the reason simply because the healthcare costs increasing. About 95% of our program is impacted by the healthcare costs. We can't really control that cost other than trying to do the wellness and other things that we do. So this increase request is substantial. At that $150 increase per member per month. Okay. So it's going to be a lot of work to try to show, and it absolutely is needed, and we're going to do everything we can to do that. Okay. So we do not know if we'll get this rate or not until the budget for the state is approved. I'm optimistic. Like I said, we're going to work hard to do that. So it's very important that we try to get that. So what the board did, which is an 11-member board earlier this month, was pretty much took an all-on-hands-deck approach, looking at our funding, our revenue, the expenditures, and everything that we have. And they basically said, okay, we're going to approve SEIB to try to get funding at the $1,175 rate. Also, because our reserves are going to come to an end, and the reserves are like from COVID dollars, the interest that's been drawn on those. If it's estimated those are going to get depleted in 2026, then we're going to have to approve SEIB to go into that retiree trust fund to pull out some money so that we can make it through 2026. Okay. And that's what we did. SEIB pulled down $30.4 million, roughly in that range, to help us with going forward in 2026. So the rate increase, tapping the trust is how I refer to that. And also in a moment, you're going to see some benefit changes that are going to occur to the program. And that we'll go into that in just a moment. So it's very important to recognize that with the healthcare costs, I would venture to say there's not an individual that has healthcare coverage in the entire nation that is not impacted by this. If you've seen the news articles, you have seen where the Department of Insurance increased private plans to be able to increase rates. There's all kinds of things going on due to that. But we have a plan. It's not a skies falling moment. It's going to be a multi-year approach. That's what we're going to do. And the board is supporting that. And we're going to educate the legislature really good on why that matters. And let me tell you, the governor's office and the legislature has routinely funded this program time and time again. Not everything we've asked every single time, but they support this very, very important benefit. And our main goal is to try to keep the most excellent benefits that we can at the lowest cost we can to the members. Okay. But we do have a situation, as everyone else does, that we're going to have to address. So I just wanted to kind of explain those two funding mechanisms that we have, just so everyone can see that, and just know that we're going to do everything we can to defend the program, keep the program as good as it's ever been, and do the best we can with that. So I believe next is going to be Jenny, and she's going to go over a few things with you. And thank you for being here today. Welcome.
Thank you. Y'all give her a big round of applause. She did. I'm so glad she took time out of her day to come. All right. I lost my clicker. No, I gotta get it on track today, don't I? All right. So now we're going to talk changes for 2026. Good news. I need a little celebration. There are no premium increases for 2026 to the member. Okay. All right. So that is a blessing in itself this year. So changes for 2026. Now, this is in your PowerPoint that I printed out. And so we're going to kind of go through these. Of course, y'all have questions. Please feel free to ask. So as you can see, the benefit, the major medical calendar year deductible. Currently, it's $300 per person with a max of 3 per family. Starting in January, it is going to go up by $50. So it is going to be $350 per person with a max of 3 per family. Okay, that's something that's coming starting in January. The inpatient hospital deductible per admission. This is also a change that your members are going to see. It's $250 currently with a $25 per day for days 2 through 5. Is it doing it? I'm sorry, y'all. Can y'all hear me back there? Okay. All right, so $250 plus a $25 per day for days 2 through 5. They can't hear me back there if I clip it, so we're just going to hold it, and hopefully I can get it together. Look at Michael. Look at our WSFA guy. I don't know if y'all remember him from WSFA, but he is familiar with all the things. Better? Better? Hopefully. Everybody good? Okay, great. Thank you so much. All right, so the inpatient hospital deductible per admission. Currently, it's $250 plus a $25 per day for day 2 through 5. Okay, so that's a max of $350 currently. In January, it is going to increase again by $50. So you will see it's going to be a $300 deductible per admission. Of $300 plus, instead of a $25 per day, it is going to increase to $50 per day for day 2 through 5. So the max is going to increase to $500 for an inpatient hospital deductible per admission. Now the ER copay for medical emergencies, currently it's at $250. It is going to increase starting in January of a $300 deductible, okay? The medical copay for the ER is going to increase to $300. It's an increase of $50. And then the ER copay for accidental injury. This is if you go to the ER for anything considered an accident. It is currently at a $0 copay, which is kind of unheard of in the medical world. Okay, so we are now going to match that, and it is going to be the same as the medical emergency copay. So I know it looks like a big jump, but this is something that actually happens with pretty much every plan. And so the ER copay for medical or emergency, accidental, it doesn't matter. It's all going to be the $300. And then our specialty and ER physician copays, okay, those are currently at $35. They are going up to $40 starting in January. So if you go and see your specialist or an ER physician, those are increasing to $40, that copay. And some other changes for 2026 with Humana. So, you know, our Humana is who administers our group Medicare Advantage plan. So starting January 1, our medical and our pharmacy coverage are going to be provided separately. Now, you guys know as active employees who are working, y'all are on the Blue Cross. So this is the Humana Medicare Advantage. This is for those members who are Medicare eligible and also retired, or if they're a retiree working, they're working less than the 10-hour threshold. Okay, so this is who this affects. Now, of course, the changes that the member will see, you will enjoy the same benefits. There's only one minor change in the prescription drug plan. I don't know if you guys probably aren't really even familiar with it, but there's something called a maximum out of pocket. The government has said last year they put a cap in of $2,000. So for our Medicare eligible retirees who are on Medicare Advantage, once they hit that $2,000 cap with drug cost, they don't pay anything else out of pocket, okay, for their drugs. So it is increased by $100. So currently it's going to be $2,100 this year. The change does not impact any of your network. The only thing that our Medicare members will see is that they're going to have 2 cards, okay? Now, these cards are not going to come in the same envelope. They are going to come in 2 different envelopes. They are going to get a new medical card, and they are going to get a new pharmacy card, okay? They will also get double the mailings. So I know a lot of people say, hey, I was sent this by Medicare and by our plan. That is going to increase because they are going to have 2 different plans now, okay? The most important thing that you need to make sure that your Medicare members know to do is take both of their cards to the pharmacy, okay? Just give the pharmacist, say, here are both of my cards, and you should be good starting in January. I do want to make note that if you have members that call about their cards and they haven't gotten them in hand by Christmas, you probably want to reach out to SEIB. You can reach out to me or Kristen, and we will be happy to get that information to Humana and have a new card sent out. All right, so now just some housekeeping. Y'all know I like my reminders at the very beginning of the day. So Form 11s. I know this is not a fun thing. It's super hard to remember, and it's just one of those extra things. But y'all, completing and submitting our Form 11s are very, very important. This is the only way that SEIB receives information about your employee's employment status and changes, okay? So if you don't have time to get a Form 11, if it's just you do them maybe once a month, I don't know how you do them, but the thing is, y'all, you can also email SEIB enrollments at alseib.org and just let us know the first date of the the date that the employment's ending to initiate the process. So if it's something where you just haven't gotten around to a Form 11, you can email SEIB enrollments and let them know it. Go ahead and let them know, hey, this member's last day is this day, just so they can go ahead and start to initiate that process. Did I say that right? Okay. All right, so some examples. I feel like examples are good because I want y'all to know how this can impact the members, okay? So this can really mess up a member if we don't do this step. So if an employee separates, but SEIB doesn't end the insurance coverage, the member could use the policy, okay, after their separation date. Then they could be responsible for any incurred claim expenses, or they might have to pay that COBRA rate, okay? They're not thinking about it. They're sick. They go to the doctor. The doctor still has the prescription or the medical insurance on file, and they're going to use it, okay? So then they're either going to have to pay those claim expenses back or pay the COBRA rate. And that's a lot for a member who's just separated from their job. Also, if the member uses the drug policy, y'all, those claims are called unrecallable, okay? The members have to pay all those costs back before they can be covered under SEIB insurance again. So, for example, let's just say you separate, you use the drug policy. Y'all know drugs are high these days. You could incur $2,000 of claims, right? So the thing is, let's just say in 5 years, you decide to come back to the state, but you still have these expenses that you haven't paid. You can't get back on the state insurance until you pay these unrecallable claim expenses, okay? That's a big deal for people who are especially starting a new job. It's very, very important. We have to do good, let enrollments know about our Form 11s, okay? Again, utilize their email address, y'all. If you don't send a Form 11 immediately, at least send an email and say, hey, Jeannie Blake is separating the first of the following month. Okay. All right, so the IBO2, you guys all are familiar with this wonderful form. This is our active employee enrollment form. We want to make sure that as a new hire, we get this form completed with the other group health insurance addendum included with it, and we want to get it to SEIB as soon as possible, okay? I know I think we say we give you 30 days, but you know, we like for you to do it at the very beginning. Go ahead and let's get them in. Let's go ahead and get them in our system. Now, I do want to make sure that y'all are communicating to people when you do new hire paperwork that only the employee has medical coverage effective their hire date. The employee only has coverage effective their hire date. Now, dependent documentation, when you are asking somebody, talking about what their first day is, go ahead and ask them to bring that documentation with them. It makes it so much easier for you guys. We need dependent birth certificates. They do have to have social security numbers, and we also need a marriage certificate. If they bring it the first day when they're doing that paperwork, it makes it so much easier. Now, of course, coverage for their dependents will begin on the first of the following month, okay? Unless the back premium is paid. So when you're doing paperwork and somebody says, hey, will my family be covered effective my hire date? The answer is yes, they can be, but they're not automatically covered. There's going to be a letter that is going to be sent out in the mail to them. Of course, y'all know everything that comes in the mail from us is going to look like what? Junk mail. So we're gonna start keeping that, right? So the thing is, we're gonna send a letter. They're gonna have a couple of, I think, 10 to 14 days to pay that back premium, okay? And that can get their dependents covered. If they choose not to pay that back premium, then the dependents will be covered the first of the following month. This is something that gets confused a lot. And we also want to ask you guys to give our enrollment staff 7 to 14 business days for processing once SEIB receives the paperwork from the agency, okay? So you guys doing the new hire paperwork, you could go ahead and get it done on the first day and send it in directly to us. But let's just say, even if the employee doesn't give it back to you, which I know it's not always, you can't control what they do. But the thing is we're going to take 7 to 14 business days from when we get it back. And I know some of you have to send it, y'all are in other counties, you have to send it through Montgomery, so it is a process, okay? And it does take time to get this done. Okay, so reemployed state retirees. I know this is something we really touched on last year. I feel like we're all doing a really good job at this, so I just want to kind of reiterate it. All reemployed state retirees, you guys, remember, we must complete the reemployed state retiree health insurance form. It's called an IB-17. It is on our website under our forms tab. If your retiree is expected to work 10 to 29 hours per week on average, they need to complete this form, okay? What happens is when we get this paperwork, we're going to hold it for 6 pay periods. And we are going to monitor how much the retired employee is working, okay? So that's something that that's a little something that's confusing as well. Now, if the employee and or dependents are Medicare eligible, the base premium for the reemployed Medicare retiree will be the non-Medicare retiree premium, plus or minus the sliding scale adjustment, okay? If you don't feel comfortable talking to somebody about what their premium is, you just have them call SEIB and we'll be happy to do it for you. And of course, it is very important that SEIB is notified if the agency, of course, that Form 11 again, or you can just send us a memo when that reemployed state retiree is no longer employed, okay? So let's just say you have somebody that came back as a retiree working and they're 70, okay? They've been working 10 to 29 hours per week for the past couple of years. Well, the thing is, whenever they decide to separate from state government, effective that separation date, SEIB has to know because they are going to swap back to the Medicare Advantage plan. You also want to make sure that your employee knows that they've got to get their Medicare A and B in place. Again, if you're not comfortable talking about that and you don't want to get in the weeds with all that, that's what we're here for, okay? Have them call us. I promise we're happy to help, okay? But it's very important because if a member separates and they don't have Medicare A and B in place, guess what? They don't have coverage. And that is not good. Okay? Okay, so we went over these last year. So these are just the health codes. I just want to briefly go over them just so y'all know. I think we have been phasing out some codes from what my IT people have told me. And so we want to make sure that these are the only codes that you guys are using when you go and put them in the new system. I think the last year the new system was in and we were all a little frantic about it, but I think we're all getting better at it, so that's good. And so, of course, you can just see what the state share is. Like Stephanie mentioned, for the full-time regular employee, that state share is currently $1,025 effective today, okay? And so we don't want you to edit any existing codes. We just want you to use these codes that are currently out there for you. Okay, y'all, I have some fun news to talk about now. Are y'all excited? Good. We're getting a new website. Can anybody give me a hallelujah? All right, y'all. So we are getting a new website. Our IT department has been working tirelessly. It's going to be so wonderful. It's going to be so clean. It's going to be great. I'm going to show you some screenshots of it. So that is coming soon. Now, we also have something in place called a two-factor. I don't even know what that word is, but y'all know about the two-factor because everywhere else in the world is doing it too, right? So the thing is in order to log on to your SEIB account, You got to go through the two-factor process, okay? So that is probably something that is going to frustrate a lot of your employees during open enrollment because normally people don't get on it except once a year, right? So the thing is when they go to get on it, they are going to have a two-factor. So that is going to be something, it's just for security purposes, that is coming your way. Now, I also want to let you guys know that we have implemented a new phone system with SEIB. So you will notice SEIB, all of our employees are going to start putting a little blurb on their email that says my phone number has changed, okay? The old phone numbers are going to be forwarded for now, but just be aware, y'all are going to want to make those updates to those numbers if you still want to get in touch with us, which I know you do. Okay, so this is just kind of going through the MySEIB two-factor. Of course, you're going to see you have to log in to access your MySEIB just like normal, okay? You got to do your password. You have to check the box say you're not a robot. And then, of course, it's going to ask you for an authentication code, okay? So that's what the two-factor is. It is going to send you a code, I believe, to an email. It's going to send you a code to whatever email address you have it set up on, okay? You have to put that in order to be able to log in. And this is our new website. Doesn't it look pretty? Oh, it's beautiful. So this is what it's going to look like. It's going to be so great. So you can see we're kind of trying to modernize everything, make it easier to get to, make it more user-friendly. I'm so excited. We're going to have, of course, the active employees, the retirees, the plan performance, and the news and updates all on the main website, just on the main homepage when you get there. So it's going to look a little different. And then, of course, at the top, you can see all of our little icons, okay? You can see employees, retirees, wellness, forms, all the things. They're just going to be a little bit easier to find. And then, so if you go under on our main webpage and go under the employees, you'll see we have the benefit guide. You see we'll have the health insurance plans. We'll have the standalone policies, eligibility, premiums. Everything will still be there. It's just going to be a lot cleaner and easier to find. And then there's going to be a lot of ways that you can navigate this website, okay? So you guys will be able to find your benefit premiums, your discounts. I know a lot of members or a lot of employees, when they come in, they're like, how do I even know what my premium is? It's going to be a lot easier to find now, okay? Standalone policies, flex benefits, it's all going to be so much easier to find. And then, of course, you're also going to see where we have our non-Medicare retirees under 65. You're also going to see a spot where we have our Medicare retirees. So if somebody is retiring and they have questions about their benefits, depending on what category they fall, you can direct them directly to the website under the retiree tab because they are separated now. Non-Medicare retirees under 65 who are still on the Blue Cross, and then our Medicare retirees who are, if they're retired, of course, they're going to be on the Medicare Advantage through Humana. And then the benefit premium rates, y'all, look how pretty this looks. It's so clean. All right, so when you click on your premium tab, it is going to lay it all out here for you. So if somebody has questions and they say, hey, I don't know what I'm paying, you can click on all of these individually, okay? And then look how pretty that is. Isn't that so nice? So you can see right here at the very top, it's what the employee pays if they have all the discounts in place, okay? So that's a wonderful, wonderful thing because you can send them directly to the website and it's right there at the very top. Of course, and then you have all the discounts listed below, but you have what the rates are with all the discounts at the very top, right there, easy to get. And then, of course, this just goes through how you can navigate the website. You guys, do we know exactly when it will be? Hopefully next week. Wow. Y'all don't hold me to that, you know, but RIT is great. They are great. You know, but how computers go, y'all know how it's. And then, of course, we have a new condensed wellness menu. So you guys can see if you go on our wellness on our new website, You're going to be able to see the ADPH worksite screenings. You're going to be able to see the state wellness center screenings. I think there's going to be your own place that you can actually go and schedule your screenings at the wellness center. So that's going to be super cool online. And then it also gives you the participating wellness screen and pharmacy locations. So this is going to be a lot more where you guys are going to have more control, okay? That's the key. I don't know about y'all. I like control. What about y'all? I don't hear it. All right, and then of course the forms, they're all easy to find in one location. You guys, right now, you just go on the forms tab when it changes over, and you're going to see all the enrollment and membership forms, all the discount waivers, all of the flex benefits, and the miscellaneous forms. They're going to be all here on one page, okay? And of course, this just goes to some of your resources. As you can see, these are the free resources that are listed. We have the Baby Yourself, the Blue 365, the Hinge Health, which they're here today. Our Blue Cross Blue Shield, Miss Lynn is in the back. And so this also talks about Teladoc Bird, just some free resources. So it's all listed under that resources tab. And then, of course, your next page is your advisor page, because we know who your favorites are, right? Right? Okay, so of course, my name is Jeannie Blake. I'm the director of the Benefit Advisors, and all of my information is here. Kristen Henderson, she is the Southwestern Benefit Advisor, and she also does a little bit of Montgomery. She is here as well, and then hopefully we will have a North Benefit Advisor in place soon. You guys, of course, can reach out to Kristen or myself, and we'll be happy to help you while those counties are blank right now. And then, of course, just the contacts. It's pretty easy, self-explanatory. And then this is where you can see all of our new numbers. All of our new numbers are going to be updated on the website, okay? So you guys can go ahead and update everything. You can also see right here, you can email SEIB enrollments. You can email wellness. This is going to have everything that you need in order to get in touch with us. And then the SEIB Wellness Center Clinic, okay? Y'all, this is going to be the clinic information and the pharmacy information. Like I said, I told you earlier, I don't know what the user app is going to look like, but I know that you guys are going to be able to schedule with the State Wellness Center through our website, which is wonderful. And so it's going to be something that I think Auburn is working on. They're hosting it. It's going to be great. You guys can do that directly through our website. So that's going to be a great benefit for you guys. And then also news and updates, okay? This is going to be somewhere where we are going to try to put things that are happening. You guys want to make sure to check back here. I'm not sure what our first news post will be, but I'm sure it's going to be good. All right. Everybody good so far? Any questions? Yes, ma'am.
As far as like when a person separates, you mentioned the COBRA.
Yes.
Did y'all send that out, or how fast did y'all send that out, or where could we possibly start like the breaks?
So she's asking about Form 11s and kind of about the COBRA rate and the COBRA paperwork and how fast that is sent out. So what happens, y'all, is when you complete the Form 11 or send enrollments an email and let us know, hey, Jeannie Blake is separating the first of the following month, that's when the COBRA paperwork is then created through enrollments. Once we put that termination in, that's when the COBRA paperwork is created, and then we mail it out. Now, there's not really anywhere where the COBRA rates are listed on the website, but of course, you guys can reach out to us. You can reach out to enrollment, and we'll be happy to give you those rates. But it kind of starts with you. So that's why the Form 11s are so important, because we don't know somebody's leaving until you tell us.
Also, is the insurance actually still good to the end of the month, or is it?
So she's asking, when somebody separates, when does the insurance terminate? So as long as an employee is employed and works the first full day of the month, they will have insurance coverage throughout the month. So let's just say if Jeannie Blake terminates tomorrow, October 2nd, then I am going to have coverage until the end of the month, and my insurance is going to terminate effective November 1st. Okay? So that's something, if it's during the middle of the month, or if they work the first full day of the month, they have to be employed the first full day of the month. They have to work that day. Okay? Thank you. Yes, sir?
When state retirees are reemployed, that their health benefits come into play. I thought we had retirees who only have to pay their payroll tax.
Okay. So reemployed state retirees. This really only gets tricky when they're Medicare eligible. Okay. So what happens if you have secured and they want to come back as a retiree working? Upon retirement, if they are Medicare eligible, they must have their Medicare A and B in place, and they will be swapped over to our Medicare Advantage plan. Okay. So when they come back as working and they are planning to work anywhere from 10 to 29 hours per week on average, then they will fill out the I-17, which is the retiree enrollment form paperwork, and then we will hold their paperwork for 6 pay periods to monitor how many hours per week they are working. Because if they are working anywhere between 10 and 29 hours per week, due to federal guidelines, Medicare will not be the primary. Okay, that's when we come in and they want SEIB, CHIP to be the primary. So that's why somebody who is on Medicare will swap back over to Blue Cross. Okay, and so once they've been paying those Medicare premiums and copays, they're probably going to be real mad to swap back over to Blue Cross. So you want to make sure that they know that this is coming, because a lot of people are like, I worked for 3 months and I've gotten a Blue Cross Blue Shield card. Yes, because Medicare says that they will not be primary if you have other group health insurance available and you're actively working through the state. That makes sense?
Thank you very much.
Yes.
Real quick, I'm going to break down the so we have several retirees that work with us based on if they're just like the so they could possibly work 1 week and then the next week they don't. So if it truly looks at as an average based on a month, something like how does that work? We've got some, we try really hard.
Yeah, absolutely. Absolutely. Well, and what I'm going to do is I'm going to pivot to LaToya Williams. She is one of our enrollment specialists, and she is here, and she is the one who actually does it. So she speaks on it. Okay. So she said it is an average. And so it's not going to flip-flop every single week. Right. Right. Absolutely. Okay. All right. Thank you. All right, everybody good? Y'all had great questions. You're awake. That's great. So now what I'm going to do is I'm going to introduce Casey Keefe. He is with Prime Therapeutics, and he is going to come up here and talk to you guys about our pharmacy benefit manager. And I don't think I have.
Y'all hear me in the back? Yes, no? Any better? Was that a yes or a no? A little bit better? It's pretty loud up here, so forgive me if I'm yelling here. Well, I appreciate the time this morning. Again, my name is Casey Keefe. I'm the Director of Account Management for Prime Therapeutics. So I'm directly responsible for the relationship between Prime Therapeutics and SEIB. So I come here with vested interest in making sure that all you and your members are familiar with the benefit, that have, that understand it. If they have issues, that we certainly quickly address those and make sure that the experience is as good as for anybody as it is for us as well.
We're gonna move you up.
You need to go up?
Yep.
Still?
Better?
Okay. So I want to give you just a brief background into Prime Therapeutics. We've now been with you all for just about a year, but we reintroduced ourselves just last year. And in that time frame, we've done a few things for our own business to make sure it's more welcoming and helpful for all of yours. So our goal now is to provide solutions to your members as if they were our own loved ones. And that's really the goal that we're making forward in all of our programming as well as our services going forward. So how are we going to do that, and how do we do that for your members? The first is to be transparent and conflict free. So you probably hear a lot in the news today, but in our realm, we don't own pharmacies, we don't own retail chains, we're not pushing you to those specific instances, we're not forcing you into areas that you have to work in. We try to be as conflict free to the retail market as very possible. We provide a holistic business or holistic specialty experience. So for those of you or your members who are on specialty, you know it's a very complicated realm. And in that, we try to use that specialty business as well as the specialty logistics for medical and RX to understand care across both of those. We integrate with Blue Cross Blue Shield to navigate long-term care for your members in the specialty area. And third, obviously, modern technology is something that everyone cares about, whether it be the use of integrated analytics, new adjudication platforms, or programs and services that will help your members in the long run. That's something we employ on a daily basis and are growing our business to that effect. And the fourth is probably the most promising and our most important, is that's purpose beyond profits. We are not owned by, we're a private entity, we're not owned by the market, so we don't contain ourselves to what's important for the quarterlies, right? We're not beholden to Wall Street or to stocks or anything like that. So we can make decisions for ourselves, for our plans, for your members, that are for the good of the member, not for the beholder of the stock or anything like that. So that's very important to us. And as we move forward as your partners, we want to make sure that you understand that we're here for you. There isn't anything in our background that is pushing towards our benefit other than the benefit of you all. So a little bit of plan 2026 year detail. I know Jeannie has spoke about this, but really there isn't a lot of changes. Your plan design will remain the same for 2026. Your formulary changes, as you may know, if you use your prescription drug benefit, that changes occur about every quarter. And there's small changes. There can be drugs that come on the program, come off the program as they become generic or they get more expensive or less expensive. We try to reduce that to the absolute lowest cost across the board. So with formulary changes, nothing really now planned for the big year except for just the normal changes, which if you have any membership that has that, they'll be notified before the end of the year. We just created our last benefit change for formulary, and the relatively small changes planned for the beginning of the year, mostly just drugs that have become generic and things that are more expensive may actually come off, but everybody will be notified of those. Your retail network changes, no major changes. We have over 66,000 chains within the United States for you all to use. I think there's roughly 1,300 pharmacies throughout Alabama that you all have access to. Anything else as far as if you have independent pharmacies or those that you may like or know, if they're not part of our network, they're free to join. This is something that we offer to anyone within the state. If they'd like to join our network, they're able to. And if you have friends, family, loved ones, whatever, you can recommend that they join if you'd like to fill there. Specialty pharmacies. So we asked that we built a program for a Credo specialty pharmacy to be the unique provider for exclusive specialty. We also allow for state wellness to be your other primary provider. So if you use specialty medications, those are the primary care providers for those drugs. And they do more than just deliver your specialty medications. They do outreach, care coordination, dose dispensing, and making sure that they understand how to use those drugs properly and that your members can actually use them correctly and manage their disease states. And the last is member inquiry. So Blue Cross Blue Shield is a one-stop shop, and it's been great to work with them. Just be aware for your members that they are the primary consideration for your contact center. We have joined with them to provide all of the same information for your RX benefit as you do your medical benefit. So I would ask you to communicate to your members that if they have questions or concerns or problems or anything, that they go first to the Blue Cross Blue Shield contact center, which is part of on the back of their cards, one-stop shop. So if they have questions, that they do make contact with Blue Cross. We, as part of Prime, are part of that. We've integrated with them to make sure you have one phone number, one card, and they can help address those questions and concerns very quickly. So I know it's common for wanting to contact the plan, and they all do a wonderful job, and you get that. This may speed up the process a little bit. And if your member has something that they need urgently, having the contact center at their fingertips will actually reduce that time frame. So I would just give you a recommendation for that. It is good to know. It is the same card. It is the same number as you use for your Blue Cross. And again, this is just the commercial, not about your Medicare benefits or anything like that. So for just the commercial plan, utilize your existing card. It is only one card, and it will remain the same as the one you have. Some other information is your My Prime member portal. And this allows you to do several things. And if you haven't built onto this program, I would advise you to set up, because it will actually help you identify drugs, identify pharmacies, price a drug actually if you want to. You can determine where your lowest cost is going to be, if it's going to be a Walgreens or a specialty drug or at a retail pharmacy or anything like that. You can price out your drugs wherever you'd like them. If you're traveling, you can do the same. So if you're getting ready to go on a big Disney cruise and you realize you need to fill something before you go, then why not pick something up along the way? You can certainly do that. You can also determine your claims history and review your plan and spend information, and you can track your prior authorizations. So I know prior authorizations are very important these days, and they can be complex in terms of your appeals and denials and acceptance and when they're going to be turned around and approved by providers, because there's a lot of steps in between getting that approval and having that drug. So having a My Prime account will allow you to track those prior authorizations and make sure that you understand where they are, and if there's anything that needs to happen in order to adjust that or change it, make sure it goes through appropriately. So on the My Prime, I would verify that you can see here that where those decisions are. You can view the decision letter if you need to have a copy of that for your records or provide to your provider, even though they'll get one themselves. That these are where you can find everything. In addition to that, I want to just give you a quick little rundown on some of these programs that we offer you. Now, there's a lot here, and they're all in place today, and there's more to come, but just to give you some rundowns on where these cost savings are. So I know it is very important for all of us to try to maintain as low of cost as possible. It's growing exponentially, and it probably won't stop just simply because that's where the markets are heading. So these programs are important for us to employ for you to reduce costs, not at just the point of sale, but for the plan in general, so we can keep costs lower and they hopefully don't grow exponentially over the years. For instance, Flex Access is a specialty copay program that we employ that helps reduce overall costs for specialty drugs. If any of you are familiar with specialty drugs, you know that they're very expensive, they're highly regulated, and they need to maintain oversight from the plan and prior authorizations. But with that comes the opportunity to reduce the cost for the user and the member significantly, and this program does that. It also coincides with our Accredo Specialty Pharmacy to reduce the overall costs of the drug offhand, as well as for the plan, and then to help navigate the use of those drugs and the actual receipt of those drugs. Meds Your Way, for those of you who use generics or they use off-label or off-formulary drugs, this is a program we employ to reduce the overall cost of the drug at the point of sale. So we use programs that are drug cards, we use your RX benefit, and we use other cash prices to determine the lowest cost of that drug wherever it is. And then that returns that cost there. So if you're using an off-formulary drug that you would be required to pay 100%, this can actually find you the lowest cost of that. Or if it's just a normal generic, it'll search all the drug cards and say, all right, you've heard online that this is the actual low price. It will find those and then provide you that lowest price. So it's really good at the point of sale to reduce overall costs in general medications. I mentioned Accredo probably more times than you'd like to hear about, but again, specialty Accredo Pharmacy, as well as your state wellness pharmacies, are your specialty pharmacies that we've designated. And again, because of the disease management as well as the care coordination that these require, be aware of this, be aware of the Accredo Pharmacy if anybody asks or they need to become part of this. There is necessary things that will help them track, similar to My Prime. Signing up for Accredo is very easy. It will also help them track and coordinate the drugs that are going to be delivered to them. You may be aware that some of these drugs have to require refrigeration or overnight, or they can't be left out on porches. They're very expensive. They have to require signatures. So this will help them coordinate everything for you and your members to ensure that that drug is delivered safely and efficiently. So I would recommend that if anybody you're familiar with is using these, that they sign up for My Prime and they sign up for Accredo so they can track these along the way. In addition to that, there's a whole host of other programs that we have in place here, and I won't go through all of them, but there are several more that are there for your use. And some of them are for the plan. For instance, High Touch is a high analytic review that looks at 10 clinical rules to reduce overall cost for the plan. That could be from dose monitoring or oversupplies of drugs, duplicate therapies, etc. So we use that to provide detail over the medical and the RX space to try to find savings across the board. In addition to that, we have Guided Health, which is a medication therapy management program that is designed to aid members that have serious chronic issues. So if there are multiple prescriptions that could have adverse drug effects, these programs automatically enroll these patients to ensure that they don't have any conflicting information with their drugs and their dispenses and things like that to make sure that they stay healthy. And lastly, Integrated RX, again, is another outreach program that we do for members with complex diseases. And if any of you are aware of those that have used cystic fibrosis or oncology clinics, it's important to keep those providers together. So this program aligns providers to pharmacists and make sure that they work in conjunction with each other at the same location to also dispense at the same location. So they don't have to run from pharmacy to pharmacy to get prior authorization or with a doctor to get these drugs. It all becomes in-house and coordinated, because with these serious diseases, we don't want them running around. We don't want them having to fight to get their drugs. It's very serious. So we ask that they be enrolled in these. We actually outreach to them and we help them manage these diseases throughout the entire state. So a whole list of drugs, a whole list of programs. I appreciate your time, but before I do, I want to ask questions and then of course butter you up with a couple of gift cards. So any questions for me on your pharmacy drugs? You can always find me in the back if you have any questions. Jeannie, I think I stayed on
You did great.
point.
Yep, he did great.
All right.
And he brings Amazon. Who doesn't love an Amazon gift card? Have y'all all signed up? Have y'all all put your name in the jar?
Okay. We'll
we
do
wanna
two
get
now,
one? Yeah.
and then we'll do two more at the end, just to make sure everybody has it.
All right.
You want to pull it out?
Y'all better get back there and put your name in.
Sonia Long.
Yeah.
I'll bring her back to you.
Sharice.
Sharice. Oh. Look at that.
Hey.
Well, thank you very much. If you have any questions, again, I'll be happy to help you. Please come back and visit me at the back.
Thank you. Congrats, ladies. We're going to go shopping later. All right. Thank you so much, Casey. So much information. I do want to say something about the Accredo online. Y'all, it is gold. I love the online portal. I don't know if y'all have gotten it online, but it is absolutely wonderful. And it's been a game changer. I really don't like talking to people on my behalf. Like, I like talking to y'all about your things, but for my things, I'd rather just do it online. So I feel like that's a great benefit that we offer. All right, so now we're going to talk about wellness. So our wellness program benefits, okay? So, of course, you guys know we have preventative screenings to qualify for that wellness premium discount, right? It's a $50 discount for you and a $50 discount for your covered spouse each month. Again, like I mentioned earlier, the Wellness Center is here. They are doing screenings today and also flu shots. So y'all please take advantage of them being here. I know I am on my lunch break today. So we also have something called Teladoc. It is online doctor visits. Is everybody familiar with Teladoc? Y'all, Teladoc is great. I have little people. We get sick on Friday nights and Sunday afternoons. I don't know about y'all, but my kid comes home with pink eye. I know what pink eye is, right? So I'm going to call Teladoc. They're going to see my child for free. I don't have to pay $75 to go catch the flu at urgent care, okay? It is a great benefit for you. They're going to do basic common cold, skin irritations. Of course, I try to tell everybody if you call them after 24 hours of having a stuffy nose, they're going to tell you live in Alabama and to go get some Zyrtec, right? I know. All right, and so we also have something called Verta Health, which we do have Kelly and Lisa in the back. Hopefully you guys have gone by their table and visited. It is a diabetes reversal program for type 2 diabetes, y'all. It's been a game changer for our members who are struggling with this disease. We also have Hinge Health. We have Miss Brooke Elmore. She is in the back of the room to the left, and it is a doctor in your phone, y'all. A physical therapist in your phone. Has anybody used Hinge? Oh, a couple of y'all. Y'all take advantage of your benefits. It's great. They treat everything from your head to your toes. We're going to hear from them just shortly. We also have Blue 365. Y'all know Miss Lynn is in the back. She provided breakfast for us, which we're so thankful for. But Blue 365 is a health and wellness discount program. There are so many things available through Blue 365 that you can get discounts on. If you have not gone and done some research on it, I would highly suggest you do. We also have something called a tobacco cessation program. It is through 1-800-QUIT-NOW. You can find a lot more details and information on that program through our website. And of course, we're going to kind of chat on that just shortly. We also have something called a physician supervised weight loss and nutrition counseling programs. Again, you guys can find more information about this on our website, okay? Our website, of course, it's going to be new and updated and user-friendly, so please feel free. Y'all send everybody to the website. If they ask you questions and you don't know the answer, I promise almost everything that they're going to ask can be found on the website. Of course, SEIB and our staff, we are always here to help you guys as well. We're ready and willing. We also have something called a Baby Yourself maternity program. Has anybody used Baby Yourself? I know I have. So I had a panda baby. I had my little pandemic baby. And so the thing is, y'all, I had a baby and it cost me nothing. Okay? Our Baby Yourself program, if you enroll before the 3rd trimester, they're going to send you some cute little gifts in the mail. They're going to give you access to Blue Cross Blue Shield to a nurse. It's going to just be somebody that you can talk to if you have questions and you don't want to talk to your regular doctor about it. Just some basic stuff. But if you enroll, it waives your hospital copay, y'all. And it really does. I paid nothing to have a baby. Okay? It's a great benefit. Please encourage those in your agency who are having a baby, or if they're younger, just coming on and you know that's in their future, please encourage them to utilize this benefit, okay? It's available for them absolutely free. All right, and so now we're going to talk about the annual wellness screening. Who is required to participate? You guys, as active state employees on the regular group 13,000, okay? You guys covered spouses of active employees, if you have non-Medicare retirees, and our non-Medicare covered spouses. Anybody on the Blue Cross Blue Shield and the group 13,000 CHIP insurance. That's who we want to get our wellness screenings, okay? Where can you go for screening? The easiest place, y'all, is at your website. When they put the list up for to sign up, go ahead and just put your name down. It's super easy. You can go ahead and get it done. You don't have to think about it again. You can also go to your county health department. If you're in or around Montgomery, you can also go to the State Wellness Center, which I mentioned. They're back in the room today. You can get your name on the list. Participating pharmacies, you can also go there and get your wellness screenings done. There are different pharmacies in each county. There are a lot of local pharmacies that participate in this, but I know Publix Pharmacy is one that's widely accepted throughout the state. Okay, now since COVID, of course, you know, the pharmacy's gotten a little bit more strict on their appointments and just showing up at their place. So you'll want to make an appointment. If you don't want to get sent home, go ahead and make an appointment to get your wellness screening. Okay, and then of course you can go to your healthcare provider. If you love your doctor, that's great. Go to your doctor and get your wellness screening done. You do have to take what's called the IB-13, which is the provider screening form. It is located on our website. Now, just know, if you go to any of those other locations that I mentioned, it's going to be free to get your wellness screening. But if you go see your provider, you are going to be subject to that copay, okay? So just go ahead. Don't be mad about it and just be aware. The thing is that if you take your form to your doctor's office, that's great, okay? But whose responsibility are our discounts? Us. Y'all know I preach this, okay? The thing is I used to be that sweet little girl behind that doctor's desk, and guess what? I don't care nothing about your wellness screening, okay? Because it's our responsibility. Our discounts are important to me. I want to make sure that if I go to my doctor's office, I'm going to get a copy of that wellness screening form, and I'm going to send it directly to SEIB. So if something happens where I have been paying that extra premium and I find out about it 6 months later, I'm going to have proof where I sent it to SEIB. Okay? It's our responsibility. I'm an employee. SEIB loves me as an employee, but they don't care what I pay for my insurance, just like you. Okay? It's our responsibility as state employees. That's very, very important that we want to make sure to communicate to our coworkers and to our agency. Of course, what are your health risks? So the thing is, y'all, we are testing screening for these 4 risk factors: blood pressure, cholesterol, glucose, and BMI. Okay? The key to the wellness screenings is prevention of strokes and heart attacks. If we can prevent a stroke and a heart attack, we can keep our claims costs low. If our claims costs stay low, we hope to keep our premiums low. That's why it's very important that we all participate in wellness. Not only you get a discount, but it keeps you healthy, right? All right, and so what if you have a referral? So if you are somebody that is determined to be at risk, let's just say you go to the Publix pharmacy and you go and you have a high blood pressure. You had a rough day at work, right? So the thing is, if your blood pressure's up, you are going to get what's called a provider office referral form. It is going to waive your copay and refer you to your doctor. You and your doctor are going to talk about your assessed risk. It could be that you do have high blood pressure and we need some medication or dietary modification changes, okay? But your doctor's going to be on point with that. We're going to go ahead and get that under control so we can prevent that happening in the future. You're still going to get your discount. You just got to work one step harder for it. Now, of course, the discount is not complete until we have received the completed provider screening form. Again, you're going to a doctor. If it were me, I would ask that sweet doctor for a copy of my screening form. They can send it if they want to, but I'm going to follow up and make sure it's been received, right? Okay, so now we're going to move on to our wellness screening and preventative screenings. So you guys know that preventative screenings, of course, are a way that we're going to keep everybody healthy, right? I promise. I know you think, oh, this wellness screening, but y'all, it's really keeping you healthy. We're trying to keep everybody as healthy as possible. So that's why it's very important that you want to go ahead and participate. And we've partnered with Blue Cross to try to keep us all healthy by this wellness screening program. Now, of course, while some preventative screenings are recommended on an annual basis, others are recommended on your age and or your gender or diagnosis, okay? So these are designed for early detection. That's why they are so important and so valuable, and it's important that we all participate. All right, so you'll see our preventative screenings. Now, I do want you guys to notice the breast cancer screenings. Remember, it was 50. It is now 40. Starting at age 40, we have to have breast cancer screenings every 2 years, okay? This is not necessarily when the insurance will pay for you to have your first screening. This is when we start monitoring you for the discounts. So if your doctor says, hey, you're high risk and you're 35, listen to your doctor, okay? Don't tell them you have to be 40. So the thing is this is when we start monitoring for that discount. Cervical cancer screenings, females age 21 and older. We have to have one of those every 3 years. This is for you and your covered spouse. Now, colon cancer screenings. This is for everybody. Starting at age 45 and older. Okay? This is a fun one. Now, of course, you can go to your doctor and you can get a test in the doctor's office. It'll last a year. Remember, we talk about you can do the Cologuard where all your neighbors will know what you're doing through the mail. But it's okay because you're going to get your discount, right? That's right. And then, of course, if you and your provider decide that y'all want to get a colonoscopy, that's great. That's fine. Don't go into your provider and tell them I have to have a colonoscopy. It's a colon cancer screening. But if you want to get a colonoscopy, that's great. If it's a good choice for you, it'll last you 10 years. Okay? We don't care how you do it as long as you do it. And then also, if you're a person with diabetes, you have to have a diabetic eye exam once per year. That form is on our website for you to take to your doctor. And then if I were you, I would send it directly to wellness myself, right? Okay. Now, all of these preventative screenings, y'all, they're claims-based. So what that means, we talked about the wellness screening. You know, when you go to the pharmacy, they enter it in the system, and then they send everything to us, or you do the provider screening form. But these are claims-based. So what happens is Jeannie's going to go get her mammogram. They're going to file a claim with the doctor's office, right? The doctor's office is going to file that claim with Blue Cross. Then Blue Cross is going to communicate it to SEIB. So it can take up to 90 days for that information to come from your doctor's office to SEIB. So the day after you get out of your colonoscopy, don't call me and say, hey, Jeannie, you see it? Not yet, girl, but it's coming. Okay? All right. At least I got some laughter out there. My girls up front. Okay. Everybody good on wellness? Does anybody have any questions? I know y'all were pros with that, so y'all don't have any questions. So now what I'm going to do is I'm going to welcome Ethan Ivy. He is with the Alabama Retired State Employees Association, ARSEA, and he's going to come up and tell you a little bit about what they do. Y'all give him a warm welcome. Thank you.
Hope this works right. Can y'all hear me in the back? Lisa, am I good? Awesome. Okay, so yes, my name is Ethan Ivy. I am with the Alabama Retired State Employees Association and the Alabama Public Employees Advocacy League. I know that's a mouthful, sorry. But what we do is represent all the retired state employees and all the local government employees. So what we do is we keep you up to date about your retirement, about your health insurance, about Social Security, any kind of legislation that's changing. We keep you up to date on all of that. As payroll personnel, you all keep your employees up to date on that kind of stuff, but as a retiree, you're just kind of sitting at home. You're like, I don't know what's going on. So we send out a weekly update to keep all of our members, making sure that they're up to date about things and all of that. And then we also lobby for your benefits at the legislature. So we work with SEIB and with RSA to represent all of you as once you're retired. We are doing a door prize. If you want to fill out the white cards at my table, we're going to do that drawing, I think, at lunch, if Jenny gives me her good graces. Awesome sauce. Great. So that drawing is for a $25 Amazon gift card. So make sure you sign up for that drawing before lunch. All right. Thank you.
So much. Oh, don't y'all love these giveaways? Me too. I'm going to be eligible. All right. Sorry, y'all. I had to get some water. All right. So now what I'm going to do is I am going to welcome, I believe I have Lexi next. And so Lexi Solario, she is with state personnel, and she is going to give you guys some really good information. So y'all please give Lexi a warm welcome today.
Okay, well, let me get all this situated now. This can't be trusted. I don't trust myself. Okay, can everyone hear me all right? Oh, that's loud. Okay, as Jeannie said, we're going to talk about paid parental leave today. That's the hot topic, right? Just a little background about how we got here, all right? And I will take questions at the end, but y'all are more than welcome to stop me at any time if it's relevant to what we're talking about. Okay, a little bit of the timeline, how we got here. Okay, I know this happened in the 2024 session. We saw paid parental leave being introduced, but now it's actually become law. It was introduced in February, passed the House, passed the Senate, was signed by the governor on April 2nd, but did not become effective, obviously, until July 1. Gave us some time to get everything prepped and ready, to get the information out to y'all to make sure we're administering this new benefit correctly, all right? So the act that made it all possible, Act 2025-81, this is the one that created the new paid parental leave benefit, all right? We'll go into a little bit more detail, but with a few limitations and restrictions, this does allow paid parental leave for eligible employees for the birth, stillbirth, and miscarriage of an employee's child. And the weeks and the eligibility and what you can have is going to vary based on, obviously, if you are a female or male. The law does distinguish between the two, and it also does apply to adoptions of a child 3 years of age or younger, all right? So with this new law obviously being implemented, we did have to do some rule changes on our part at state personnel, okay? We had to update our donated leave board rule because donated leave for maternity and adoption purposes is no longer available because paid parental leave obviously is a new benefit, okay? So we did amend our donated leave rule to make sure that maternity and adoption are no longer available for donated leave, but obviously paid parental leave is there now. Donated leave, though, is still available for a catastrophic illness or injury, though. Okay, so don't forget it's still there, just not for maternity or adoption anymore. We did file an emergency rule on July 1 to get this obviously updated, and then we had to go through the normal rulemaking process as well, with our permanent rule being effective October 13th. But the emergency rule obviously is still in effect until that date, okay? We also had a brand new board rule for paid parental leave to obviously help administer this new law, okay? And all it does, it just goes in a little more detail, maybe just a tiny bit more detail than the law actually does, just to provide some procedural things that, you know, the law is not obviously going to be specific about. Same here, emergency rule was filed on July 1 with our permanent rule being effective October 13th, okay? These laws are obviously almost permanent, so you can find them on the Alabama admin website, which you can access through the legislator's website as well. Okay, I don't know, my personnel people in the room, I'm sure y'all have seen this. We created this very, very pretty and elaborate paid parental leave manual. If you haven't seen it, we'll be happy to share it with you all. I think it's like going on like 30-something pages, so it's very, very detailed. We have, you know, pages of FAQs of potential questions that that you possibly could ask, but we've got some questions that we did not include, so I'm always happy to add or address any questions we have not handled quite yet. But this was disseminated to, I think, all personnel managers. I think some people might have been missing from the email list, so if you haven't got it, please email me. I'll be happy to get that sent to you. We want to make sure you have all the documents you possibly can. Included in this manual is a sample policy. Your policy does not have to be exactly like this, but the law does require y'all to have some sort of policy in place at your agency, and we just want to do that to assist y'all. Also in the manual, we have sample letters. We have a certification form, which we're going to talk about in a little bit, that we did create for y'all to utilize as well. I will say, well, I guess I'll talk about it now. I forgot. I just looked at the slideshow for the first time this week. I apologize. So I will say you have to use the certification form that we did create, because this law does apply to multiple branches of government and even outside the entities that are outside the merit system, okay? Like community colleges, local boards of education are included in this legislation, and we have been directed that all of these entities should be using the same certification form. Doesn't mean you can't put your logo on it or, you know, make it more aesthetically pleasing, but the information should remain the same, all right? And if you haven't gotten that, that's also in the manual, but also happy to send that to you as well. Okay, eligibility. In order for an employee to be eligible for paid parental leave, they have to have 12 consecutive months of employment with some sort of executive branch, legislative, or judicial branch entity, okay? So it's a little different here, where I know sometimes when we talk about the FMLA eligibility does not follow you from agency to agency. Paid parental leave, it does, okay? The law is specific about that. So the 12 consecutive months of employment do not have to be specifically at your agency. If you work at personnel for 6 months and then you move to conservation for 6 months, that 6 months will travel with you with respect to your paid parental leave eligibility. Okay, so that's a little different here. The eligible employees that this law does apply to are specifically listed in the legislation. That really is kind of basically everybody for the most part. Obviously, employees of the legislature are going to be included, employees of the Uniform Judicial System, AOC, and then basically anybody that falls within our system, okay? It's all specifically listed in the legislation, but also listed here as well. Like I said, entities outside of our system, like local education boards and agencies and the community college systems are included, but they went through their own rulemaking process and forms and things of that nature, but it all looks very identical to what we have done, okay? So you're gonna see it looks very similar no matter who is administering this benefit. And then, like I said, this law did become effective July 1, 2025. I did run numbers maybe a couple weeks ago, and I think as of the last pay period, we had 30-something people use paid parental leave. So not everybody and not every agency has experienced paid parental leave. So if you do have questions about when it first comes up at your agency, obviously feel free to reach out to us about that as well. And we'll talk about this again, but the law also is very specific about you can only use paid parental leave once in a 365-day period, okay? The 365-day period can either begin the day of the qualifying event or the first use of paid parental leave. So in 365 days after that, whichever one occurs sooner. And we'll get into more detail about that as well. Okay, so how much paid parental leave can an eligible employee get? If you are a female employee, You can get 8 weeks of paid parental leave for the birth, stillbirth, or miscarriage of your child. And then for a male employee, they can get 2 weeks for the birth, stillbirth, and miscarriage of their child. Okay. Remember, like I said, the law specifically only applies to adoption of a child 3 years of age or younger. It does not apply for children over the age of 3 in order for an employee to get paid parental leave. For adoption, it's 8 weeks of paid parental leave regardless of your sex. But if both parents are eligible employees, then one will get 8 and one will get 2. Okay, so that's one little distinguishing factor there as well. It has been impressed upon us that if you do have 2 eligible employees that are obviously adopting a child together, those agencies need to work together to ensure who's getting the 8, who's getting the 2. They should not both be getting 8, right? I will say one specific thing the law does not cover is obviously fostering or temporarily taking care of a child. It only applies to actual adoption, and the law specifically says that. So foster care, temporarily caring for a child, and things of that nature are not going to be covered with respect for paid parental leave. It's only specific for adoption or the initiation of the actual adoption process. Okay, so paid parental leave usage, I feel like a lot of us probably are familiar with donated leave. So this is where it's a little different. Okay, remember in donated leave, you had to exhaust all of your accrued leave before you could utilize donated leave. That's not the case with paid parental leave. Paid parental leave, you do not have to exhaust any of your leave in order to obviously access it. Paid parental leave can be used intermittently on a reduced schedule, or you can use it continuously, obviously depending on the needs of the employee or the child. One thing I will say that the law is specific about is paid parental leave can be used on an intermittent basis for bonding, but it has to be agreed on prior to them using paid parental leave. Okay, that's the only time that really has to be approved prior. I will say an employee obviously taking paid parental leave for bonding should maintain a continuing parental role, which is defined similarly to the FMLA, which means you are having to take care of the day-to-day responsibilities of the child or you're financially supporting the child. So very similar to the FMLA here. How we can use paid parental leave really with respect to adoption and birth, you can use it really any way you want. The law obviously has a lot of discretion here. Employees can use it on an intermittent, reduced scheduled, or continuously. One thing that I will say it applies to both birth and adoption is they can use paid parental leave, or the eligible employee can use paid parental leave prior to the birth or adoption of the child. Okay, but if they do use it prior to the birth or adoption of the child, the 365 days starts the first use at that point in time, and it ends 365 days later. So why would you use paid parental leave prior to the birth or adoption of your child? You can use it just like with the FMLA, prenatal doctor's appointments, morning sickness, mandatory bed rest, also for adoption, attorney appointments, social worker home visits, court appearances, and things of that nature as well. Okay. And then, like I said, if they do use it prior to the actual date of the qualifying event, that 365 days starts the day of their first use. Okay. So pay while on paid parental leave, the law is very specific about this, is paid parental leave is going to be paid at 100% of the eligible employee's base salary. It is paid, the word is in there, employees will be paid while on this specific type of leave. How are hours calculated for paid parental leave? It's going to be based on the employee's average work week. So if you have your typical 40-hour week employee, they'll be eligible for 320 hours. If you have a part-time employee that works 25 hours, it'll be prorated to the 200 hours. So whatever their average work week looks like is going to be dependent on how many hours of paid parental leave they will receive. Okay. Very similarly to FMLA, they will be eligible for COLAs, merit system raises, things of that nature. Obviously, you should not be making any negative employment decisions based on their use of paid parental leave. Okay, it cannot have a negative effect on the employee-employer relationship. Okay. A couple other things that are very specific in the law: paid parental leave has no cash value. If you don't use it, you lose it. It doesn't roll over. You can't donate it. It doesn't go anywhere. It doesn't go to calculating retirement benefits or things of that nature. It's there if you need it. If you don't use it, you don't use it. It doesn't help you in any other aspect there. Okay. And like I said, can't roll it over, can't use it. You can't try to grow your paid parental leave and say, okay, well, I didn't use 8 weeks last year, so I'm going to use it this year. I mean, that's not how it works. Okay. You use it when it's available. Otherwise, it doesn't roll over. You can't use it for subsequent events and things of that nature. Just like with the FMLA, the law specifically does say employers are going to be required to maintain the employee's health insurance. I don't think that's anything shocking to anybody at all. You would just maintain their health insurance, obviously, like they have been continuously employed. Okay. With that being said, this is obvious, I think probably pretty obvious to the group here, but obviously the employee will still pay the employee portion of their health insurance. But like I said, that just gets deducted out of their check like normal, and they're getting paid, so that won't be an issue. If an employee is eligible for paid parental leave and FMLA, they do have to run concurrently. Okay. If paid parental leave is available, the employee cannot go on leave without pay if paid parental leave is an available option for that employee. Okay. There certainly can be instances where an employee may be eligible for paid parental leave and not FMLA leave. That certainly can happen. They'd still be eligible for paid parental leave. But if they do become FMLA eligible, then that paid parental leave will start running concurrently with FMLA. Any questions so far? I was trying to make up for lost time, so we were running a little behind. I'm trying to keep y'all on schedule.
You're doing a great job.
Any questions so far? This one? Oh, you're fine. I'm sure. Do y'all send out the slides too?
It'll be
They will also have these slides available online that I have been told. So if you want to come back and reference it, y'all are more than welcome to. Any questions so far about what we've talked about? Yes, ma'am.
VFC has like 10-hour employees and 12-hour employees. How do we post their time for it? Do they get like their 8 weeks? Do they just get 320 hours?
So it would just be based on the employee's average work week. So I guess you would factor in how many, if they work 10 hours, then how many hours a week do they work?
Well, like for our 12 hours, 1 week they
And I might not be the best person. This might be more of a payroll question. Looking at my payroll people. They're like, no, I don't see y'all. So you would probably look back probably, it's either 6 months or a year, and you do the average is probably what would happen. But I'm not going to be the end all be all on that one. It seems like a Sherry, Nikki probably won't call my specific payroll people out here. But I would get your payroll people to contact our payroll manager, either Sherry or Nikki, about that specifically. But I'm assuming that's how we do other things. So I would assume that's how paid parental leave works as well. But verify with them, because I don't want to be wrong about that. Any other questions? Okay. So requesting paid parental leave, there is specific, first of all, the law does provide some guidance on this, but we did go a little bit further just to make sure, obviously, agencies have all the information they need to know if their employees are going to be eligible for paid parental leave. So first, remember, like I already said, they do have to submit that certification form. It's a certification form that we created that all other entities are using. Local boards of education are using it. Community colleges are using it. Anybody that falls underneath our purview, they're using it as well. We have been informed that everybody needs to be using the certification form. Like I said, doesn't mean you can't put your logo on it or just jazz it up, but all the information should remain the same. Okay, so please keep that in mind. Paid parental leave should be requested 30 days prior to the use of paid parental leave, but obviously there can certainly be instances where that's just not possible with maybe a miscarriage or stillbirth. So as soon as they obviously have the information, they need to get that to you ASAP and fill out the forms and information. An employee can withdraw their request for paid parental leave anytime prior to the start of their paid parental leave. Like I said, if an employee is on FMLA, they cannot go on leave without pay if paid parental leave is there. They're going to be required to use their paid parental leave before they go on leave without pay. Obviously, just like with the FMLA, once you received all the information from the employee, you obviously have to review it, and then you need to let them know, I think within 5 business days, if they're going to be eligible for paid parental leave or not. Okay, so you got to put them on notice or let them know if they need to submit additional information. Also, in our very elaborate manual, we have put all the information regarding required documentation. Some of this is from the law, but some of it is obviously just trying to provide some guidance on what y'all need to ask for in order for an employee to get paid parental leave. Like I've already obviously said 1,000 times, y'all are tired of hearing me say it. They do have to submit that completed certification, which I think is maybe 4-ish pages long. But obviously it's very important information that they need to fill out. Also, the law specifically says that the employee has to submit a written plan for leave. Okay, and we're going to talk about that on the next slide. And like I said, that's in the law, so I'm just letting y'all know. And then obviously additional documentation depending on what they're taking paid parental leave for. So obviously it's for the birth of a child, a birth certificate will do, or some sort of documentation from the healthcare provider confirming that the birth actually occurred. Obviously, if it's for the stillbirth or miscarriage, some sort of documentation from the healthcare provider, obviously confirming death or potentially a death certificate. Or if it's for a miscarriage, documentation from the healthcare provider confirming the miscarriage, or really any documentation supporting or establishing paternity, which birth certificate is obviously probably a good one here. And for an adoption of a child 3 years of age or younger, obviously still need the certification and the written plan for a leave, but also really the paperwork can really be anything that either the adoption process has been initiated, or it's currently ongoing, or it's final. So any sort of court documentation regarding that will be sufficient for adoption. So this is what the written plan for leave should include. I do know it's been brought to my attention, but like I said, this is specifically in the law. It's a written plan that's required. I know a lot of this information is already included in the certification form, but nonetheless, you still need to have this information also submitted from the employee. So the written plan for leave is going to include the date paid parental leave is expected to begin. Obviously, that can be fluid, especially with the birth of a child. You can't always anticipate, like, my child's going to be, you can say they're going to be born on that day, but they might not technically be born on that day. So whatever their expected date of paid parental leave is to begin, their projected return to work date, which obviously could be off by a few days as well, whether the employee intends to use paid parental leave prior to the birth or adoption. So if they want to start utilizing their paid parental leave prior to the qualifying event, that needs to be detailed in the written plan. And if the employee is requesting use paid parental leave intermittently or on a reduced schedule, they need to have some semblance of what their schedule is going to look like to submit to their employer to let them know how their work schedule might be a little different. And then any other information that you all think that you need, as long as it's obviously not super unduly burdensome to the employee to get said information. Just like with the FMLA, guys, very similar language here, and I actually think it might be the exact same language now that I'm thinking out loud about it, is you are going to be required to reinstate these employees to basically the same or equivalent position that they had prior to their use of paid parental leave. Very similar to FMLA. I think we're all used to this language, and we know sort of what that means. Obviously, just give them the same job they had before. If an employee believes that their agency has failed to comply with the reinstatement requirements under the law or board rules, they can file an appeal to the State Personnel Board, our board. An employee and an agency have a right to be heard by the State Personnel Board or some sort of special hearing personnel, maybe an ALJ at our agency, and present evidence. Once the decision of the State Personnel Board has been made, it is final. Okay, but there is that little small appeal right here with respect to paid parental leave. Returning to work, again, this is specifically in the law, not anything that we came up with. An eligible employee does have to agree in writing that they will remain employed for a period of at least 8 weeks following their conclusion of their paid parental leave. Okay, that's specifically in the law. And it's to be a requirement regardless of who took the paid parental leave and how long. They're still going to be required to remain in pay status for 8 weeks following paid parental leave. Obviously, if the employee fails to remain in pay status for 8 weeks, the agency can either substitute accrued leave or deduct any uncovered leave from the employee's final paycheck. This particular, or everything I just said, can certainly be waived. This is specifically mentioned in the law. It can be waived if the employee is unable to return to work due to obviously the serious health condition of an immediate family member, then this particular section would be waived. I am no expert on this, and again, I've already shouted out Sherry and Nikki, and not gonna point out my payroll people here today, but how to code paid parental leave in HRM. I think this is pretty self-explanatory. We haven't gotten a whole lot of questions about it, but these are the usage codes you would use depending on what the employee is using paid parental leave for. Okay. And notice there's different codes depending on if they're using paid parental leave just by itself or paid parental leave concurrently with FMLA. Okay, the law does require state personnel to report the usage of paid parental leave, so that's why we have to use these leave codes, so we obviously have the correct data and information. Okay, but again, I'm no expert on HRM and or payroll. So if you have questions about that or how it works, Sherry and Nikki, they're your go-to people. I'm sure they'd be really excited about me shouting them out when they're not here, but it's gonna be okay. They're the experts. They've already handled so many of these questions anyways. Oh, and that's it. I think I maybe got us back on track. I don't know. Anybody have any questions before I leave? Yes, ma'am. Of course. Any other questions? Yes. Probably just me. Do you want to write it down? You can just send me an email. Everybody can have it. It's Lexie, Lexie, dot Solorio, SOLORIO, at personnel.
What was that?
I'm sorry. Are you talking about my last name? It's complicated. SOLORIO. Good now? At personnel.alabama.gov. But yes, I'm happy to send the manual to anybody that needs it, which includes certification form, and any information. Not that I'm more than happy to answer any questions, but that has a ton of information in it that I think is super useful to y'all as user agencies. Okay. Thank you.
Thank you.
Of course.
All right. Thank you, Lexi. You did such a great job. All right, y'all. So moving on, I am going to introduce with Empower Isaiah Heilman. And he is going to come up and he is going to talk to us about our retirement benefits. Okay, so y'all give him a warm welcome. You might want to put it on some. There you go.
Like everybody else. Good morning. Can everybody hear me? I've never been one to be told that I talk too low. So, but can you guys hear me in the back? All right, that's awesome. So I'm Isaiah Heilman. Unfortunately, you guys got the B team. I got called in just a couple minutes ago to do this plan because Nick McKay, who's the local retirement plan advisor here today, he got called away. His daughter got rushed to the hospital with some sort of allergic reaction. So if you guys would just remember him in your thoughts and prayers until she's doing better. But we did have to go deep and get me. But I'm your Central Alabama retirement plan advisor. So I'm cover all the central counties from Mississippi to Georgia. So if anybody who is here in those agencies, in those counties, feel free. I'll be back there on the left side all throughout the day, probably to leave around your guys' lunch break. Your third break or something, 2:30 is when I've got to get out of here. But what we're going to do is just kind of do a little brief overview. I was looking at some of these slideshows, but like I said, I just got put on the spot for this, but just trying to help Nick McKay out. But as Empower, just quick show of hands, how many's familiar with the Alabama Retire 457 plan? So we got a few right there. Okay, that's awesome. A lot more than I anticipated. But if you guys, when you guys enter the state, you have multiple different areas in which you could put money. One is absolutely mandatory, and that is your pension, and that is RSA. So as soon as you got into the state plan, they started to grab money out of your paycheck like hungry hippo. You know, that's coming over there and that's growing, and that's designed once you qualify for, retirement to pay you a certain amount for the rest of your life. And that's amazing. Well, you also have two other state-sponsored 457 plans where you could kind of supplement a little extra income. A lot of people in times past, what they used to do is solely dedicate their retirement savings and their retirement planning for pension and Social Security. And when they finally did retire, after 25, 30, 40 years, they went into retirement with pension and Social Security. And what they found out was they were lacking a little bit of income. Their pension and Social Security did not cover all of their expenses in retirement and left them with a little bit of an income gap. And so to fill that gap, that was the creation of the 457 plans. The state personnel board back in the mid to late 80s, decided, hey, we're going to help these employees out and try to give them an opportunity to stay retired instead of having to come back to work either full-time or part-time. And so that is the little history of the 457 plan and why that it is in existence. It's to help give you guys every opportunity to retire and stay retired comfortably. And so what the 457 plan allows you to do is put a little extra money away from now until retirement. And so when you do finally retire, you will have your pension, Social Security, and then if there is any income gap, you will actually be able to fill that from the monies that you've built up over the years from this account. And so with the Alabama Retire 457 plan, you guys also have unfettered access to a lot of cool things. One is a retirement plan advisor. All of the retirement plan advisors on our plan are licensed both state and federally as investment advisor representatives as well as registered representatives. So with the Alabama Retire 457, you could not only just put a little extra money over there from now until retirement, but we double down and we couple that with a no additional cost to you retirement planning session. And in that session, we do a retirement plan for you with a licensed advisor. So me and Borna and Trace and Nick, who's not here. But in those sessions, what we do is we kind of develop a little retirement GPS for you. So we look to see where you're currently at for savings for retirement. Where do you want to go? And then we kind of hit start and show you turn by turn how to get there. But it's not just like a one and done thing. Like, hey, congratulations, you're in the state. Hey, here's your initial retirement plan. Good luck for the next 30 years, right? We actively try to develop great relationships with our participants so that we can meet on a regular basis, I say annually, so minimally meet with your advisors on an annual basis to update your plan. Because in 365 days, there's a lot of changes that happen. Either your income goes up or your income goes down. Unfortunately, sometimes that happens. Expenses go up, expenses go down. Different things happen in a year's time that we need to capture those changes to make sure we are still tracking for your retirement success. Albeit rerouting, retirement GPS, right? Rerouting, and we show you how to take those changes, roll with them, and learn to still be able to retire with your objective in mind. And so with our plan, you have unfettered access to us. You have our email, you have our cell phone numbers, you have our main line number, and we are there for you and dedicated to each and one of you guys. We also have a passion to meet you where you're at. So each one of you guys are at an agency here, there, somewhere in the state, and we love to try to get into y'all's agencies to where we could talk to all the people who are first coming on, the new employees, to all the people who's got a foot out the door and ready to retire in the next 3 to 5 years. And we try to meet with you guys where you're at and just help you to learn more and more about your finances and to help guide you through that retirement process, or even help guide you through just your journey of working for retirement. And so that is kind of what we do, and that is our bread and butter, and that is a big differentiator between us and your other option, which is RSA 1. You'll hear from them a little bit later. The minimum amount to get into our check is just our accounts are just $10 a check. I could definitely waste that. I did waste that coming up here, getting 2 Red Bulls and some beef jerky. So I could definitely waste $10 a check. But that's the minimum amount to get in. And then the maximum amount that you guys could contribute into this plan is a pretty decent amount. So if you're under the age of 50, that max is $23,500 in 1 year. If you're above the age of 50, that actually goes up to $31,000 in the year. Then if you're between the ages of 60 and 63, you can actually contribute up to $34,750 in this plan. Then at 64, it goes back down to 31,000. Don't really ask me why, because that's just the IRS making rules up. But it does drop back down to 31,000. So you could put back a significant amount of money into this plan. A lot of people also ask me, after kind of telling them a little bit about our plan, they're like, "Hey, listen, I'm literally almost out the door. I've got 3 years or less. What is the benefit for me to get into this plan now?" I could understand how it's beneficial for somebody who's been here just a couple days to a couple years, but with me, how is it beneficial to me? And I'll tell you, we also have a special catch-up. Special catch-up will allow you to put up to $47,000 in that account this year, or even within the last 3 years of your retirement, so the last 3 years. And special catch-up, a lot of people utilize that specifically for sick and annual leave. So sick and annual leave, whenever, you guys love y'all's jobs, and for some reason it seems like you have a big number built up of sick and annual leave when you guys start to retire. The state will pay you for a maximum of 600 hours of, I believe, your sick leave and 480 hours of your annual leave. So cumulative 1,080 hours at your hourly rate. That could be a significantly big check. And that is viewed as a bonus. So those are actually taxed at a higher rate. So anywhere from 30 to 35 plus 40%, it depends on how big that check is. You could actually take a significant tax hit on that check. To bypass that, you could actually roll up to $47,000 into the plan to bypass that big tax burden. And you could then, after about 30 days, 45 days after your separation of service, if you needed access to those funds, then you would have access to those funds and they'd be readily available to you. There would still be about a 5 to 7% hit on there because you'd have to cover your sick, your FICA, Medicare, and Social Security, but bypassing the bigger hits of the state and federal bonus rates are the key thing there. And so that alone right there is a huge benefit that people could utilize if you're within those 1 to 3 years of retirement, and that's how this could be beneficial for you. Some of the things with our plan, we also have pre-tax and Roth designations, much like RSA 1 does as well. Pre-tax, anything you throw into a pre-tax account, you're just kind of kicking that tax can down the road until you finally separate service. So it's going to lower your tax liability today. So that's the tax benefit of a pre-tax savings. It lowers your tax liability today, but whenever you do finally retire and you start taking distributions, that's when you're going to start paying taxes on that on a later date. And it'll just come out as regular income. Most of the time we're in a lower tax bracket, so you're not paying as much income tax, but that's not always the case. Some people making tons of money in retirement. And so I hope to be that lucky when I get there. But then we also have a Roth option. So whenever that comes out of your net check, and so the amount of money that usually hits your account, that if your contributions come out of that, taxes has already been paid on it. And so it'll come over here and it'll grow and grow and grow. And as long as you have a Roth account for 5 years and you're over the age of 59 and a half, when you start taking distributions, all of that income would be absolutely tax-free income. So saving up tax-free income sounds amazing. And so you have the opportunity here with this account to do pre-tax or Roth, or you could elect to do both. So I know a lot of indecisive people, and they're like, I don't know which one to do. And so they'll just elect to do both of them, which is perfectly fine. And then in our plan, we have the flexibility to change that. So if you got in Roth today and decided tomorrow that you wanted to change it, you could absolutely change that. It might take one full cycle for payroll to catch up, but it would change, and you could opt in and out of pre-tax and Roth. Also, you could increase and decrease your contributions online or through the app that we have to download. We also have a loan provision with our plan, and the loan provision is there for your benefit. And what it's designed to do is help you out in a pinch, right? It's not really there for, Christmas, bonuses or lack of bonuses and just get in there. But it is there for any amount of reason, any time that you need access to your funds. Through our loan provision, you have access to them. You have to have an account balance of $2,000 or more. But as long as you have an account balance over $2,000 more at any given moment, you could access up to half of your funds in your account. The max loan is $50,000, so you would have to have $100,000 in there for that max loan. But and there are some principal and interest that you would have to pay back, but all principal and interest payments go back to you because you are the lender and the lendee. There's only a $95 origination fee to get the loan started. And then for the life of the loan, there is a $6.25 quarterly maintenance fee that is taken out of that. But that loan is there for you. There's no early withdrawal penalty. I know there's a lot of questions on that. If I access this through the loan, there's no early withdrawal penalty. And then you also don't pay taxes on that loan amount that you pull out. But that is there for you in the time that you get a crunch and you need access to your funds. You have access to your funds through there. We also have beneficiaries, as many primary and contingent beneficiaries that you want or need. We have them on there. So in the event that something happens to you, as long as you have some named beneficiaries, this would automatically roll over to them and allow them to access your funds. If you don't have a named beneficiary, your account would go to your estate, and then it would go through a lengthy probate period before you had access to your funds. And then, like I said, we also take it serious that we are there for you anytime. I know Nick says that he schedules appointments on the weekends to try to help you guys out and I've done it as well. We are all dedicated for you, and we're here for you. We also take rollovers. I just remember that. I just read it right there. Rollovers of 403Bs, 401Ks, old IRAs, old 457 plans. We actually accept those, and you could kind of springboard your savings over here. And then something else that you guys have access to, which is just kind of new, the State Personnel Board turned it on this year, is access to our financial planning team. So I and all of us retirement plan advisors, we're all licensed advisors and registered representatives, but we look at you through the lens of retirement. So when we do a retirement planning session with you, we sit down and we look at some of your assets, we see all your expenses, and we kind of give you a plan for that retirement planning session. In addition to just us, you also have unfettered access to our financial planning team. In our financial planning team, you have a wide range of planning that they go through. They go through college planning, expense pay downs, debt consolidations. They go through, also we do the retirement planning, but they do that too. They look at outside assets. So if you do have a brokerage account or some other assets that you want them to kind of go through, they go through that. Estate planning, insurance planning, planning on planning. They go through it very, very good with a fine comb. Yeah, tooth. Thank you. Fine tooth comb. And they go through that very well. But you guys also have access to them at no additional cost to you. And so that is a little brief overview that I have. I apologize. Nikki had a really good slideshow that he was going to go through. And unfortunately, like I said, you got the alternate, mine. Are there any questions before I find my seat back there in the back again. All right. And then on the giveaways, I mean, everybody's giving stuff away, right?
Yeah.
So I would like to give away, a free 45-minute retirement plan session for anybody who wants to come over there and sign up for it. I'll give that to you. Okay. All right.
Y'all, best deal of the day. I've done one. They're great.
Thank you, Judy.
Thank you so much. All right, and y'all, I'm going to now introduce Mr. Joe Hocutt. He is with Southland, and he is going to chat with us briefly about some of our standalone policies, and then y'all know what's next, lunch. Okay? All right, so y'all please welcome Mr. Joe.
Thank you.
I'm on, yeah, he's going to get through that. All right.
Well, thank you. And I'm the only thing keeping you between lunch, so I'll try to be quick, but I want to also be thorough as well. Southland, we've been doing business with state since 1983. Our holding company was founded in 1933, so we've been around a long time. From an administration standpoint, is that better? How about that? Okay. Maybe I got on the wrong side. The biggest thing that we'd like to tout is the fact that we don't use an IVR system to answer the phone. We answer with a human. And that's really important not only to the members, but to providers as well, so they can get in touch with someone immediately, answer their questions, answer their concerns, and things like that. We answer our calls normally under 10 seconds, at the most 30 seconds, which is about 3 rings. So we're very proud of that fact, and we want to be staffed that way to where we can take care of members and providers when they call and take care of the needs or answer any questions they may have. We've also been recognized as one of the top 50 call centers in the U.S. of our size. And on our commercial outside rate, we have a 99% retention rate. So we're very focused in on membership and the insureds and the services in which we offer them. And for the providers, what they like is we pay over 96% of all of our claims within 10 days. So they get their money very, very quickly. Privacy and compliance. In today's world, everyone's worried about cybersecurity, fraudulent claims, and things like that. So we go through a SOC process, which is a nationally recognized audit in terms of your operations, as well as HIPAA training for privacy. And I'm proud to say we've never had a data breach. I better knock on wood on that, but we've never had a data breach. Our DentaNet network, which is used for our dental policies, we own that network, so it's proprietary to us. We've got over 1,700 providers and doorways. I call providers' offices. We call them belly buttons and doorways that your people can go see. With us being in Alabama, unlike some of the large nationals that are covered just in Mobile, Montgomery, and Huntsville, and Birmingham, we're throughout the state because of all the state employees where your folks are located. We've got we're in Barber County, we're in Choctaw County, we're in Greene County. We're spread throughout the state with our providers, and we're very proud of that. Dental oral exams, why they're important. First things, on an oral exam, believe it or not, your gums are one of the first areas that show inflammation if you have inflammation in your body. So that's signs of infection or disease before it's experienced with any other symptoms. So it's really important to get your oral exams. Preventative complications, gum disease, heart disease, again, can all be identified by your dentist and recommend you to your primary care physician if they identify something. Increased confidence, obviously clean teeth, nice smile, better confidence, right? So that's the reason. Another reason it's important for the mental health.
Avoid costly procedures. You go in and get your teeth cleaned. You identify a filling. You get the filling taken care of. You avoid costs such as root canals, a cap, or a partial, having an extraction. Checkup. This is something if you go into, no matter how hard you brush, how hard you try, how much you floss, you'll never get all the plaque and tartar out from under the gum line. You really need to go in and let a hygienist do that that's been professionally trained and get that taken care of for you. The importance of dental care for lifestyle, again, just a healthy life, and any type of preventative maintenance you can do or checkups you can do is really important to staying healthy for a long and healthy life. On the dental plan summary, there were no changes this year. And the biggest thing is too, there's no cost for preventative services. So those x-rays, those exams, those are all at no cost to you when you go in and see your dentist. If you do have something like a filling, a crown, or something like that, there is a deductible. If you're an individual, there's zero deductible. If you have a family, it's $25. And the basic and major services, the basics would be things like a filling. A major service would be an extraction or bridge or a cap, something like that. Anyway, they're covered at 80% as individual and 60% as family. Large benefit maximums, again, as an individual, it's $1,250, and as a family, it's $1,000. And the dental plan coordinates with any other existing coverages. So if you have another coverage through something else, this would pay secondary to that. Again, just the plan summary. We went over before. For the employee only, it's $1,250. The family's $1,000. No deductible. No cost for preventative. Only a deductible on the family plan. Preventive services covered at 100%, and then the major and basic services covered at 80% on an employee only and 60% on the family. Example of savings. Now this is example, and this is the reason it's important to have the insurance itself, the dental insurance. A basic filling without insurance would cost you probably $200 out of your pocket. The negotiated fee or the network fee is $99. Of that $99 that the dentist would provide, because they're going to write off the other $101, call it, they write that off because that's been negotiated down. So if you did not have insurance, you'd be paying a full $200. But even with the insurance at $99, if you're an individual, it covers 80% of it, or $79.20. Which means you walk out of there just paying the provider a little over $19. On the family side, same situation. You had a family member go in and say, this is the first episode for anyone in your family. It's your spouse, your child, whatever you go in. That cost would be, they cover 60%, so the coverage would be $59. So your out-of-pocket expense would be $39.60. And if this was the first time that person needed something, you'd have the $25 deductible for a total cost of $64.60. So again, tremendous savings there. And the biggest thing is just being insured to where you get that discount off what would be retail for doing a filling. Same way with a crown. If you needed a porcelain crown, if it got to that point where you needed a crown for your tooth, same thing. The cost is about double for a crown. On the individual side, it would be 80% would be covered, or $500. You get the crown done for $125. On the family, same thing. I just went ahead and on the worst case where you have the deductible, your total cost is only $275. So that's $275 for something that would probably cost $1,300, if not more, if you did not have the coverage. So that's a huge, huge savings. Next is vision. Again, your vision, they can identify that. As a matter of fact, I was just with a friend this weekend. He was getting his eye exam. They did the retina exam, checked. He got sent immediately to his primary care physician because when they do the scan of your eye, they identified sugar on his retina, which is a really bad sign. If you're diabetic, you know that, and they identify that. He got sent to his primary care physician, got treated, and that's how he found out he was diabetic. Again, you can identify hypertension there, stroke, heart attack. And then 80% of all child learning is visual. My wife's an educator. She sees that all the time. So when a kid's sit middle of the room, back of the room with not corrected eye care, it's really hard for them to see the board or see the teacher and really understand what's going on. The other thing, 75% of all adults or all people in the U.S. need some type of corrected eye care. So what's covered is the eye examination, the eye frames, or you can get prescription contact lenses, and there is no network provider network that you have to go to. You can go into any one you want to see. So here's the benefits. It's for an eye exam, it pays up to $95 of the exam. And this is an indemnity plan, so it's just straight out. So when you get frames, you've got $95 to spend on your frames. And then depending on your prescription, whether it's a single, bifocal, trifocal, or lenticular, you can see what it covers: 100, 130, 180, up to 205. Or contacts, if you choose to go to contacts opposed to eyewear, you get up to $180. And again, there was no change in the plan, no network requirements. The benefits are it covers certain qualifying cancer diagnosis, and you can understand that's kind of a summary of everything I've already said. This is a good product here, the hospital indemnity. You got an employee-only plan, and you've got a family plan. And so if you're in the hospital and you have a hospital stay, in addition to your medical, because this doesn't matter what the medical coverage is, this is what it will pay. It'll pay in-hospital daily benefit of $150. As an employee, maternity $150, ICU $300, and long-term care $150, supplemental accident $1,000, and ambulance benefit $100. So there's a lot in that plan. It covers a lot. Hopefully you don't have to use that, but it's a great benefit if you do have that need, because if you have a long hospital stay, you're probably going to be off from work. Others in your household may need to be off for work to take care of you as well. So it's very important that you've got monies coming in. And again, this is in addition to whatever medical care you have. True Hearing, that's for your hearing aid device. It's a discount plan. It's through True Hearing. Got the information on that. But the key thing is you have to call, and it's a concierge service. You have to call and set that up. Then they'll walk you through the process. You call them, you contact them, they book an appointment for you. They let you know of an office that's close. They schedule the initial appointment. You get fitted for your hearing aids, and they get ordered. You come back, they get fitted, and then you have your hearing aids, and it's usually anywhere from 40 to a 65% discount. If you know anyone that wears hearing aids, those are a very expensive piece of equipment, very sophisticated as well. And then True Hearing issues users and answers any questions, and they have warranty and I think batteries for a period of time as well. So that is it. I'll take any questions real quick. I'll take one or two questions if anyone has any questions. If not, oh, right here in the front.
I've had several people ask, they have the vision insurance, but they don't have a card or anything.
If the question was, she's got someone who has vision insurance, but they did not get a card. Two ways you can go there. You can go online, and anybody can go online if it needs to be day of. You can go to southland.com. You can go online. You can put in do the login. I think it's your email address or date of birth. Anyway, you log in. But anyway, you can get a real-time ID card. It's a PDF, just so you can print it off. Or you can call us, request an ID card. We'll get an ID card printed to you and mailed to your home address. It does not have to go through HR. They can just call and do it themselves. I need a new ID card. Okay. I'm sorry, what? Yes. Yes, it's still a free program as long as you have any coverage. That's a good point. It is a free program.
And I think you're covered, your parents. Like if I have
Yes.
it, my parents can use it.
Anyone in your household or immediate, our parents are covered. All right. Thank you very much.
Thanks, John. Thank you so much. I'll see you in the morning. Okay, y'all, before we go to lunch, I'm going to get Ethan to come back up. He's got a giveaway. So exciting.
You want to pick out the name?
Ooh, I don't know.
Okay, I can pick it out.
Yeah, you can do it. I'd rather you.
Okay. I'm not looking, so don't blame me. All right. Nikki Barnes.
Nikki
Ah.
Barnes. What's the score?
Congrats.
Y'all are doing so good. Okay, and then we have one final giveaway before lunch. So I'm going to let my friends from ACI come in and kind of talk to you just for a brief moment because we know you're hungry. And so if y'all. Oh, okay.
Everybody can hear me, I promise. Can you hear me in the back? Okay.
All right.
Thank you.
We're good.
My name is Tim Tadlock. This is Christy Whaling. We are from ACI. How many of y'all know what ACI or who ACI is? I've got a few of them. Okay. All right. Well, just a little quick synopsis of who and what ACI is. We actually take and train and extend knowledge to our team members. Okay. They're incarcerated by the state of Alabama. But what we do is we give them that opportunity that when they do get out, or EOS, which means end of sentence, that they can get into the world and they'll have a trade that they can go in and be a good citizen in society instead of a menace like they started out to be. So I believe everybody believes in second chances. Yeah, I know I do because I needed about 3 or 4 or 5 or 6 or 10. Okay, so basically what we're going to do is give you 2 things. One, we're going to do a giveaway in just a second. And the other thing is, I need you to put down and write down this date, October the 8th, 1400 Lloyd Street is going to be our open house.
Y'all got your flyer inside your book.
Yes. If there's a flyer in there, look, come over, check us out. We'll feed you. We're going to have door prizes galore. We're going to have a good time. Okay? Now, if there's anything that your agencies need throughout the year, we are there. Okay? We have people on site at the showroom, and we also have people in the field like myself, and I have 2 other colleagues that go out into the field. And they also sell to all the different agencies. So, how many's hungry? Yeah, that's what I thought. Let's do the giveaway, okay? I'm going to let you want to draw it? Sure. Please, and give me a name. Okay. I'm just trying to see what she's doing. Brenda Kirkland, where you at? All right. Come on. Look, these people are hungry. We ain't got all day. Let's go. What your giveaway was is she gets a set of standard business cards, 500 of them. That's what we're going to give to you. And what you'll do is get a hold with Christy, and she'll get all your information, your agency, and we'll make your card just exactly like you'd like it. Okay, folks. Thank you. Y'all have a great day and a great new fiscal year. Okay.
All right. Thank y'all so much. Okay, y'all can go to lunch. We will start back right at 12:30.